Travel nurse. What is travel nurse? Travel nurses are RNs from various clinical backgrounds who work for independent staffing agencies. They are assigned to different care areas on a temporary basis to fill in short-term employment gaps. Travel nursing is a specialty that needed when the field of nursing faced a nationwide shortage. Travel nurses are often fill open positions. These travel nurses can work in healthcare in any state in the country and also can work outside of the country as international travel nurses. The advantages of travel nurse are adventure and excitement of new opportunities and higher pay salary than average pay. Essential of travel nurses. Travel nurses are an important part of the healthcare because they help bridge the gap between supply and demand in the field of nursing. The nurses come from educational backgrounds, care areas, and geographic locations, bring a great deal to the practice of nursing. These travel nurses can share ideas and practices not only benefit patients, but also other nurses. How to become a travel nurse? A travel nurse should have the following characteristics to excel in the role. Enjoys experiencing new cities, towns, and organizations. Enjoys freedom. Travel nurses choose when and where they work, and choose their duration of employment. Enjoys flexibility. Travel nurses create their schedules, benefits packages, and income based on which agency they choose to work. Thrives on challenges. Moving to different states or overseas and being the new nurse repeatedly is challenging. Learning new organizational systems and workflows is particularly challenging. Loves learning new things. Each assignment takes travel nurses to new healthcare facilities, some with higher levels of technology or different standards of practice. Each experience helps nurses build upon their knowledge base. Additionally, travel nurses should have supportive families and friends. It's difficult to either pack up and move an entire family or leave your family and friends behind. The flip side to this is that new relationships are formed in each new location. Educational requirements for travel nurse. Those interested in the specialty of travel nursing should first pursue a nursing degree through a 2- or 4-year university. Obtaining an associate's degree, ADN, or bachelor's degree, BSN, in nursing is required. A BSN is not required to be a travel nurse, but some healthcare facilities only hire BSN-prepared nurses. The staffing agency in which the nurse is employed should match the nurse appropriately based on educational requirements. After completion of an accredited nursing program, successful completion of the NCLEX-RN is required for licensure. Most travel nurse agencies require a minimum of 1 year of hands-on experience in the chosen specialty of nursing. Additionally, some agencies will only hire BSN-prepared RNs. International travel nurses should speak the language of the country they are to practice in, as communication is an important part of effective healthcare delivery. Nurses are encouraged to research agencies when considering travel nursing. Any certifications or credentials needed. No additional exams are required for travel nursing. Based on the specialty, certifications may be required. Examples include medical/surgical nursing. O. Basic life support, BLS. O. Advanced cardiac life support, ACLS, may be required. O. Stroke care certification. O. Telemetry certification. Intensive care, ICU, nursing. O. Basic life support, BLS. O. Advanced cardiac life support, ACLS. O. Pediatric advanced life support, PALS. O. Critical care nursing, adults, pediatric, neonatal. Women's health/labor and delivery nursing. O. Basic life support, BLS. O. Advanced cardiac life support, ACLS, may be required. O. Pediatric advanced life support, PALS, may be required. O. Neonatal resuscitation program, NRP, certification. Emergency room nursing. O. Basic life support, BLS. O. Advanced cardiac life support, ACLS. O. Pediatric advanced life support, PALS. O. Neonatal resuscitation program, NRP. O. Trauma Nurse Core course, TNCC, certification. Additional specific requirements may be necessary for international travel nurses. These include acquiring a passport and work visa, usually handled by the agency. Additional immunizations. Learning a new language. Learning about diseases unique to the area. Role of domestic or international nurses. Travel nurses have a broad range of responsibilities and duties, and specific tasks depend on the specialty in which the nurse is trained. General nursing responsibilities and duties include using the nursing process of assessing, diagnosing, planning, implementing, and evaluating to care for patients in a variety of healthcare settings. Administering medications and fluids, assisting with activities of daily living and patient mobility. Reviewing and interpreting diagnostic tests such as lab work and imaging. Provide monitoring and oversight in all aspects of patient care. Collaborating with physicians in developing a plan of care. Assessing the psychosocial needs of patients and families. Recognizing and intervening in clinically unstable patients. Providing resources for patients and referring as necessary. Educating patients and families in all areas of healthcare maintenance and prevention. Working in assignments anywhere from 8 to 13 weeks, on average, in the home country, 1 to 2 years if outside the home country. Learning various patient care systems/documentation. Providing immediate medical care and aid for large populations during times of war or disaster. Domestic and international travel nurses also have different characteristics specific to their roles. Domestic travel nurses work within the home country. Typically work assignments that range from 8 to 13 weeks. Can respond to areas of the U.S. that experience natural disasters or disease outbreaks. International travel nurses. International travel nurses should have excellent communication skills, should be open to new experiences and challenges, and should have a strong desire to learn. These nurses are responsible for performing a wide array of duties. As stated previously, the tasks an international nurse will have to perform depend entirely upon their medical specialty. Some of the more general or everyday tasks that international travel nurses will perform include administering medication, wound care, and providing emergency medical services and care. Since there are often nursing shortages in many of the regions that international nurses travel to, another general role of these nurses is to educate family members and caretakers about the appropriate patient and medical care. In summary, international travel nurses work outside the home country. Typically work assignments that range from 1 to 2 years. Respond to areas that experience natural disasters or disease outbreaks, such as the Ebola outbreak in West Africa. Provide medical care and aid to underserved, rural, and remote populations. Usually must wait for document processing before traveling. Salary and benefits for travel nurses in U.S. Travel nursing has many incentives for nurses regarding pay and benefits, including travel reimbursement, free housing, bonuses, medical, dental, and vision coverage, retirement plans, assistance in obtaining passports/work visas, choice of location, selection of hours/shifts worked, competitive pay, higher than average pay for RNs. According to Indeed, the average yearly salary for a travel nurse is $75,109. However, since pay is competitive in travel nursing, some companies are offering salaries of around $100,000 annually for domestic travel nurses. International travel nurses tend to have lower salaries than domestic, except for assignments in some Middle Eastern countries. This is because, for the most part, nurses tend to make less outside of the US. Salary is dependent on the agency, and nurses should research each company to find the right salary and benefits that best fit their needs. Travel nurse salary in India. In India, travel nurse earns an average 35,000 Indian rupees per month. Thanks for watching this video. Any questions, comment below. Thank you all. If you like this video, like, comment and share to all. Thank you.